When I was in, middle school and high school, I used to see the orthodontist for regular braces, and I was intrigued by dentistry as a profession since then. As I got into, my later years and then went into undergrad at Texas A&M, I shadowed a few dentists, and I decided that's the path I wanted to take for my career. I liked science. So it was right in that realm, and I liked working with my hands, and kind of found the perfect balance with dentistry. So at Legacy, I'm the medical director of dental services, and mostly it's patient care. When I saw an opening here and I read about Legacy and their past work with HIV patients and the collaboration they have with community health and other departments, and just the approach, that's what drew me to Legacy, because I think that's where medicine, dental, pharmacy, everything is headed. We're more cohesive as a unit, not just dentistry and then good luck with everything else. And here at Legacy, we have other primary care physicians. We can make sure the patient is being seen for all their needs. Obviously, with COVID and everything, we have been upgrading our equipment and more sterilization, new air purifiers that remove contaminants in the air. So I think we've done a good job safeguarding patients and staff members. The way dentistry has changed is we have a lot more protocols in place, so appointments take a little bit longer. And the patients appreciate that because they know we're doing everything in their best interest. So I was born and raised in Houston. My parents immigrated here in the early 80s from India. My father worked at the post office for 33 years, and from him, I learned punctuality, hard work, and ethics. He wouldn't ever be late. He would treat anybody he met along the way with the utmost respect, and I took those qualities and I use that in my day-to-day practice as a clinician, as a dentist here at Legacy. I do my best possible treatment, and I'd like to think that all my patients are treated to the utmost respect, and I have a clinical, ethical background that stems from my father and watching him and how he treated people and how he worked, and I like to think that I'm doing my best impersonation of him, and with my patients, I'd like to think that I'm treating them the best as I can.